So if you really want the best result from your hip replacement, honestly, the best outcomes are going to come from you doing as much as you can. You're going to realize that even the day after surgery, maybe two, you're going to see a big difference in your pain level already. You'll have some soreness from your hip, but surprisingly, as big as the surgery is, you do quite a bit better than you're expecting. We only keep you one night in the hospital. Sometimes we don't even keep you in the hospital. We have you walking the day of surgery. We have you walking quite a bit, but it's not just walking. We want you doing. We want you getting up and down stairs. We want you sitting in a chair, getting out of a chair. We want you doing things. The people who do the best, just like other joint replacements, are the people who just do. They do things. They have activities. Go golfing if you like golfing. Go shopping if you like shopping. Get in and out of the car. And you can drive a car oftentimes. The right and left leg are different as to when you can drive, but that's an activity you want to do, and you want to push yourself towards that goal and within a couple weeks. But pushing yourself and wanting to have goals and doing things really will produce a nice outcome for your arthroplasty.